Hello, welcome back to Constitutional Drug Series. This is Dr. Gayatri, BHMS and REBT counselor. Today we are going to discuss the drug phosphorus. Now, physical appearance of phosphorus. They are usually tall, slim, sharp face features. They are beautiful like an atramure. Phosphorus can be given for both female and male patients, so it is kind of 50-50. They are more flexible, graceful, as it is written here. Body is loose and relaxed, tends to move with effortless grace. The limbs tend to be long and graceful, more flexible than most of the other constitution, beautiful, tall, slim. The face is sharp, beautiful, with long eyelashes, wide mouth, soft, waxy or smooth skin. Hairs are silky, light brown. If you know actors like Deepika Padukone from Bollywood, she is like a phosphorus personality, look wise. And an American actress, Julia Roberts, if you Google her photo, then you can see how her features are sharp, and she is tall, fair, slim, with long eyelashes, wide mouth. सो अगर आपको कोई भी फीमेल या मेल पर्सनालिटी टॉल, स्लिम, विथ फेयर लुक, लॉन्ग आईलैशेस, सॉफ्ट वेक्सी स्किन ऐसे कोई दिखाई दे, सो दैट कैन बी फॉस्फरस. फॉस्फरस यूजुअली एक्टिव रहते हैं, इंटेलिजेंट रहते हैं. लाइक आपको लगेगा वाह कितना एक्टिव और इंटेलिजेंट बंदा है या बंदी है. सो दैट काइंड ऑफ पर्सनैलिटी इज़ यूजुअली फॉस्फरस. ये जो रहते हैं लोग वो भी टॉप 5 के लिस्ट में रहते हैं, लाइक रैंकर्स रहते हैं. अगर बच्चों की बात की जाए तो फॉर एग्ज़ाम्पल अगर मैंने कुछ भी नहीं पढ़ा है साल भर भी, और एग्ज़ाम के 2 दिन पहले पढ़ा है, फिर भी मैं टॉप कर जाऊँ या फिर फर्स्ट 5 में रहूँ, तो दैट काइंड ऑफ चिल्ड्रन आर यूजुअली फॉस्फरस, जो कि बहुत होशियार होते हैं, इंटेलिजेंट होते हैं, एक्टिव रहते हैं. You will get impressed by them. So that kind of personality is phosphorus. Phosphorus sometimes resemble tuberculinum as they are closely related type. Other characteristics are they desire cold drinks, ice creams, chocolates, sometimes ice cubes also. And phosphorus is chilly patient. Yet they desire for cold drinks and ice cream like that. Also they have fear of darkness, or fear of imaginary things. So if you want to identify phosphorus child, so वो शाय रहते हैं, timid रहते हैं थोड़े बहुत, tall, fair skin, long eyelashes, रेस्टलेस भी रहते हैं, फियर ऑफ डार्कनेस रहता है, लाइक्स चॉकलेट्स, कैंडीज, आइसक्रीम्स एंड कोल्ड ड्रिंक्स, एंड स्माइली फेस रहता है उनका, एंड थिन बिल्ट. ऑल्सो दे आर वेरी मच प्लेफुल, एंड पर्सनैलिटी वाइज दे आर वेरी मच एक्सट्रोवर्ट इन नेचर. दे ईजीली मिक्स अप विथ पीपल. So these kind of personalities are phosphorus. Now we'll go into boric first paragraph part. Phosphorus irritates and inflames and degenerates mucous membranes, serous membranes, inflames spinal cord, nerves, causing paralysis and destroys bone, disorganizes the blood, causing fatty degeneration. It is one of the most important hemorrhagic remedy where there are bright red hemorrhages. Clinically can be given for hematogenous jaundice. It produces a picture of destructive metabolism, causes yellow atrophy of the liver and subacute hepatitis. As we have discussed, it can be given for tall, slender persons, narrow-chested, with thin, transparent skin, weakened by loss of animal fluids, with great nervous debility, emaciation, amative tendencies. Phosphorus has great susceptibility to external impressions. It has a great susceptibility to external impressions, to light, sound, odors, like that of Naxomica, sensitive to external changes or external sudden noises, etc. Thunderstorms. Suddenness of symptoms is marked keynote. Sudden prostration, faints, sweats, shooting pains, etc. Blood extravasations, fatty degenerations like cirrhosis, caries are pathological states often calling for phosphorus. Muscular pseudohypertrophy, neuritis, inflammation of the respiratory tract, ill effects of iodine and excessive use of salt, worse lying on left side, pseudohypertrophic paralysis, ataxia, bone fragility, and osteomyelitis. These are again the clinical symptoms. Mind symptoms are there is great lowness of spirits, great tendency to start, fear of dark, fear of ghost, like fear of imaginary things. There is sometimes loss of memory, but phosphorus patient, as I said, is very much intelligent, very much intelligent. Paralysis of the insane ecstasy, dread of death when alone. That's why he or she is usually extrovert, doesn't like to be alone, fear of being alone. Brain feels tired, he is excitable, also he is very much sensitive yet indifferent. So this is again a characteristic symptom of phosphorus. Restless and fidgety feeling. So phosphorus can be given for digestive disturbances, for liver conditions mostly, for hemorrhages, like for example dysfunctional uterine bleeding in cases of females, like menstrual complaints. So we can think of these conditions. Even alopecia, migraine, eye symptoms. So we'll go one by one, and it is mostly a chronic drug. It can also be given for degenerative conditions of spine where there is burning changes, severe burning changes or sensations are present, which are mostly relieved by cold. But yeah, it is given for a chronic complaints and not for acute complaints. Head complaints, vertigo of the aged after rising, which is also seen in bryonia. Heat comes from spine, neuralgia, parts must be kept warm. Burning pains are present, chronic congestion of head and brain fag are the main important symptoms. Vertigo with faintness. Itching of the scalp, dandruff, as I said, it can be given for alopecia complaints. So phosphorus hair fall is falling out of hair in large bunches. So it can be given in puberty, during pregnancy or after pregnancy it can be given. Eye complaints, cataract, sensation as if everything covered with the mist. It can be given for edema of lids and about eyes. For eye edema, you can think of phosphorus, both the eyelids. Upper eyelid is usually kali carb and lower eyelid is apis mellifica. Partial loss of vision from abuse of tobacco. Diplopia due to deviation of the visual axis. This is usually clinical symptoms, but we have to refer it to patient for giving allopathy. Glaucoma, cataract, these conditions are surgical conditions. So just I am reading it. Degenerative changes where soreness and curved lines are seen in old people. Retinal trouble with lights and hallucination of vision. Hearing is difficult, especially to human voice. Nasal complaints, bleeding, epistaxis instead of menses. Yes, this is again an important symptom. You can say as a concomitant, you can take it. Oversensitive to smell, fan like motions of nostrils. Hemorrhages are bright red color can be given for polyps. Face blue rings under the eyes, pale complexion, tearing pain in facial bones. Mouth complaints are swelling and easy bleeding of gums, toothache, persistent bleeding after extraction. So, in these cases, arnica can be given. Staphysagria also is one of the important remedy after extraction of tooth, but phosphorus has hemorrhages. So, this is the keynote. Thirst for very cold water, dryness and phosis. So usually there is dryness of mouth, so it is considered thirst for very cold water. Stomach hunger soon after eating, sour taste and sour eructations after every meal. There is belching, throwing up of the ingesta by mouthfuls, vomiting. Water is thrown up as soon as it gets warm in stomach. Post operative vomiting, cardiac openings,